a new laser center making news in the skincare world. It provides help for patients with acne, tattoos, and leg veins. And it's right here in North Texas. Dr. Samuel Lamb runs the office called the Luminaire Laser Center, and he is here to explain how this new procedure works. Good morning, Dr.
Good morning.
Lamb. How are you?
I'm doing wonderful.
This sounds exciting. Tell us about the Luminaire Laser Center.
I'm excited. It's been a project I've been working on the last year, and it's really finally come to fruition. It's really putting disparate parts together to make this a reality. I've really been happy with every element of it. My staff is great. I have to start with that. They're really experienced and wonderful in the field of laser and mesotherapy, and I'll explain what that is in a moment.
Okay.
But really just an incredible, technically precise staff, which is that way they can really deliver a customized result for each patient, and that's very, very important to me. The other thing that's really important is the technology. Yep. I mean, I've got to say that if you don't have the technology, you really have nothing else to
offer.
offer.
And what is that technology?
Well, we got a lot to talk about today, don't we? We have a lot of different things, and hopefully it won't be too confusing. We'll try to do this in a very methodical manner. But it's an incredible different technologies we have out there, and also in a boutique center. And I put the whole thing together. I really love it. I did 25 paintings in 3 weeks. So it was crazy. For people that know my art, this is a whole different adventure. Maybe we have to do a segment on that, right? But it's really quite wonderful. And in the technology, I think the centerpiece of the technology is plasma. And plasma, to give you a little bit of history of where we've come from the past till today, you got to look at about 13 years ago. 13 years ago, we had a product called the carbon dioxide laser. That was like a ballistic missile. And 3 months of recovery time, you know, progressive loss of skin color over a few years. Too much of a risk-benefit ratio, in my opinion. I never incorporated that into my practice.
So this lowers risk and there's less recovery time, which sounds like a win-win all around.
Absolutely. And for people that are familiar with the physician-strength peel, which puts you through about a week of recovery time, the plasma is very similar. It's basically, plasma is a very funky word, but what it means is it's a nitrogen gas that hits the skin and causes a really deep, nice change to the skin that you get immediate benefit from, but you get a benefit that continues over about a year. So it is about a week of recovery time. There is no discomfort. You won't look great that week, but that's one of sort of my serious player, the one that I put out there to help my patients that really, really need it.
Well, let's talk about photofacials. Are they the same, or have they changed?
They have changed dramatically. And if you look at a photofacial about 10 years ago, 5 years ago, 2 years ago, there's an incredible evolution. I've ditched really the old technology because it just doesn't work. I think part of what you need to start out with when you understand photofacials is understand that the photofacial has been oversold. It's sort of by spas and salons and other places sold as the sort of the panacea for all problems. It really isn't. It does its job, but what I try to do with this laser center is not use everything through one technology. I look at it as through a multifaceted approach. In other words, saying, okay, here's a person that has wrinkles. What am I going to do to take care of the wrinkles? I have a person here that has some color changes. Well, I have a specific photofacial that manages color. The best way to understand it is a photofacial is not designed to manage wrinkles. It really doesn't do that much work. I did a paper, not to get too scientific, a paper about in 2002 that looked at the changes in the skin using photofacials, and there was changes there, nice changes, but the problem is we don't see it. So I would say that that is the big change, and really what my photofacials today is predicated on safety, and really nice sort of improvements in the color. Those are the big things. The other thing that if I can look at as a counterpoint to the plasma, something that where someone needs less than a week of downtime, for example, I have something called the pixel. Now, I'm going to throw a big word out at you guys, but I know you have an educated audience, and they're going to get it. It's called microfractionated, all right? And you look very serious now.
Yes. Microfractionated sounds like a very serious word.
And what microfractionated technology is, essentially, is if you look at the full spectrum of treatments, there is something that's really aggressive, well, you know, or at least stronger, that gives you a week of downtime. And then people really can't afford that downtime. So they're looking for a magic solution which can give them something real, which maybe a photofacial can't quite deliver in terms of the result, except for the color. And this really manages wrinkles. And
so this is an option.
It is. And what microfractionate does is it's a computer-controlled laser. So the laser doesn't take away all the skin. I think those lasers are outdated now. It's a little bit of a micro-puncture into the skin, and you can titrate that for a day, 2 or 3 days of recovery time, but something to really deliver a great result. And that's called pixel technology.
This is amazing,
I don't even know if I can spell it.
Well, let's talk touch upon one other thing.
Yeah.
There's new treatments for acne.
Absolutely.
What are those?
Well, you know, the mainstay today, what I see that's so remarkable today is the blue light therapy. And blue light essentially is a non-invasive technology. That truly is just a walk-in, walk-out technology. And what you're seeing on the graphic here is what blue light does. It targets the bacteria. As you know, that's the real source of the problem with acne. And what's great about blue light is it's a walk-in, you lie down in the blue light and you walk out, and the results are really quite good. The thing I want to emphasize, I don't want to mislead the audience, I want them to understand truly what the role of blue light is. It's not the day in, day out therapy. You got to get good skin care, you got to take care of your skin. I've got great estheticians on board to help you with that. But it's sort of that, one is a backup technology, it's also an adjunct, so something that's there to help.
Such great information, cutting edge technology. Thank you so much for being here today and explaining all this. It's very exciting that this laser is now in North Texas.
Too.
We have options for our skin. All right, thank you so much. And you can find out more about Dr. Lamb and the Luminaire Laser Center by logging on to lambfacialplastics.com. We'll also have all this information on our website, wfaa.com/GMT.